The human knee joint joins the thigh with the lower leg. The knee joint permits flexion, extension, and rotation of the leg. The knee withstands an immense amount of stress and pressure. Stress and pressure are applied to the knee when an individual is walking, running, or merely standing. The human knee is the largest and most complex joint in the body. Injuries to the knee are one of the most common causes for doctor's visits in the United States. The human knee is composed of 3 joints, cartilage, 2 menisci, 5 ligaments, 3 bones, and a tendon that runs over the knee. The femur is located superior to the knee joint. The patella is located on the anterior surface of the knee. The patella is a tiny bone on the front of the knee. The function of the patella is to protect the knee and connect the muscles in the front of the thigh and tibia. The patella has articular cartilage on the posterior side in order to allow for the bones to move smoothly along one another when the leg is moved. The tibia is located inferior to the knee on the medial side. The patellofemoral joint is a partially synovial gliding joint. The joint is composed of the femur, the tibia, and the patella. This joint is located on the anterior surface of the knee joint. The patellofemoral joint is involved in 2 actions, knee extension and flexion. The lateral and medial tibial-femoral joints are classified as synovial hinge joint. This joint is composed of the femur and the tibia. The tibiofemoral joint is located on the posterior side of the knee joint. This joint is involved in extension and flexion of the knee and tibial rotation inward and outward. The menisci are located superior to the tibia. The medial meniscus is located on the medial condyle of the tibia, and the lateral meniscus is located on the lateral condyle of the tibia. The menisci also articulate with the femur. The menisci steady your weight on the knee, protect the bones from creating friction, and absorb shock. A tear of one of the menisci can occur from a football tackle, a pivot, or turning quickly when the foot is planted and the knee is bent. There are 3 types of menisci tears: minor, moderate, and severe. The minor tears may induce moderate pain and swelling and will typically heal within 2 to 3 weeks. Moderate injuries to the menisci cause pain in the knee, and swelling will gradually increase, making the knee stiff and limiting range of motion. Symptoms may decrease but may return if the knee does not have enough recovery or rest time. A severe tear in the menisci occurs when portions of the menisci shift into the joint space, causing the knee to swell, lock, or give out. The transverse ligament is located on the anterior surface of the tibia and connects the medial and lateral menisci to one another. The function of the transverse ligament is to stabilize the medial meniscus. The anterior cruciate ligament and the posterior cruciate ligament attach the femur to the tibia. The anterior cruciate ligament originates on the lateral femoral condyles of the femur and attaches to the intercondylar ridge of the tibia. The ACL functions to stabilize the knee joint and limit lateral rotation of the tibia. The anterior cruciate ligament is often torn due to the thinness of the ligament. ACL injuries are common in athletes who take part in high-demanding sports such as basketball, football, and soccer due to the fact that these individuals often have to change direction quickly. The posterior cruciate ligament attaches to the intercondylar ridge of the tibia and originates on the medial condyle of the femur. The PCL stabilizes the knee joint and limits lateral rotation of the tibia. PCL injuries can occur when an individual is involved in a car accident or in sporting events. The fibular collateral ligament, also known as the lateral collateral ligament, is located on the lateral side of the knee joint. The fibular collateral ligament originates on the lateral epicondyle of the femur and inserts into the head of the fibula. The tibial collateral ligament, also known as the medial collateral ligament, is located on the medial side of the knee joint. The tibial collateral ligament originates in the medial epicondyle of the femur and inserts into the medial condyle of the tibia. The 2 ligaments are involved in stabilizing the knee joint. The MCL and LCL are involved in approximately 25% of knee injuries in competitive athletes. The MCL and LCL are often injured when direct contact places stress on the opposing side of the knee. For example, an MCL injury would occur when pressure is applied to the knee on the lateral portion of the knee, causing the knee to stress toward the MCL, ultimately resulting in a tear. The quadricep tendon originates in the quadricep muscle and runs over the patella and becomes the patellar ligament at the apex of the patella. This portion of the knee originates as a tendon and changes into a ligament because the quadriceps tendon connects muscle to bone and the patellar ligament connects bone to bone. The patellar ligament inserts into the tibial tuberosity of the tibia. The most common injuries to this portion of the knee are tears due to the tendon or the ligament becoming weak and falls that impact the front of the knee. A tear in the quadriceps tendon is very rare and typically only occurs in older people when the tendon becomes weak. The patellar ligament is often injured when an individual lands from a jumping position with their knee bent and foot planted. As previously stated, the knee joint is the largest and most complex joint in the body. The knee joint absorbs a lot of stress in an individual's daily activities, which contributes to the number of injuries to this part of the human body. The knee joint is built to aid individuals in their daily activities, such as walking, running, and standing.